A small farming community of Talton in Krugersdorp in South Africa recently received a gift of life, a mobile clinic. Now, these people join the civilized world and will get primary health care on their doorstep. Let's take a look at this insert.
But how many of them will reach adulthood? Over 11 million children under the age of 5 years die every year from curable diseases and malnutrition, many of them from developing nations. Health will be one of the issues topping the agenda at the summit. But about 50 kilometers away, the impoverished community of Talton is grappling with life and death issues. They have never had a clinic. The nearest is 15 kilometers away.
People die
here because there is no clinic. The nearest is in Magaliesberg. People like the elderly and children have no money to go to clinic because unemployment is very rife.
But at last, a good Samaritan arrived today. A mobile clinic equipped with medical supplies will at least provide the locals with primary health care.
Before waiting for anybody to do anything, we wanted to show as an NGO that things could be done. We don't want to go as South Africans with a begging bowl all over the world. People can see what we are doing, and we're interested in really helping. We have the projects, it can be done, it has been proven.
Health authorities say a shortage of funds is the main problem.
We have budgets, we've got budget limits each year, so you can only spread it in terms of maybe a 5-year time frame or something like that. It's just a question of not being able to do everything at the same time.
The gift might have arrived too late for the frail and the elderly. But there is hope for the future, only if the efforts of people like Dr. Suleiman can be supported by the world leaders deliberating issues that will sustain life and the earth. Linda Mgobozi, SABC, Krugersdorp.
All people coming here at Nazareth and showing off what they can do all the way from Korea there. We brought you earlier on an insert on the gift of givers, and we're now joined by Dr. Imsia Ismail Suleiman, who is also involved with the gift of givers. Doctor, tell us, we saw there the insert that shows people and a clinic being erected in just under 10 minutes, really. Could you explain to us more how that works?
It's pre-built in a factory. That was our 14th clinic that we opened up. In fact, on that morning, we opened up 2 clinics. We do it in partnership with the government, with the health department, and 14 erected throughout the country have now seen 1.4 million patients.
Tell us what that does really to people who probably could, if it weren't for initiatives like this, could not get Medicare.
Yesterday, Manny Dibiko, Premier of Northern Cape Province, was with us, and he said that if we did not open the clinic in '95 in Rimpas Mark, for the last 7 years up to, people would have not received medication and any kind of services. In fact, he requested 4 more, and he's extremely happy, and so are the other departments, that this is a great service to the country.
Now, Doctor, the sustainability of this initiative, it looks all well and good to erect this thing in under 10 minutes, but beyond that, how can it be sustained? Can it be sustained?
It can be sustained. Trials have been sustained for the last 7 years quite successfully with different health departments in the country. It's a partnership arrangement. They provide the medication and the nursing staff, and up till now, they haven't failed us.
So you provide, what's your part? You provide the equipment and the erection of this clinic?
Yes, it's pre-built in a factory. It's a containerized clinic. So we erect it in a factory, bring it and set it on the ground, and at several stages we do supply medicines and refurbish it, renovate it, provide additional equipment if required.
Well, Doctor, I know you are aware of what's taking place now, the Summit on Sustainable Development here in South Africa, and I'm sure looking at our continent, a lot of people are actually lacking on Medicare. Should we expect to see this maybe going beyond the South African borders?
Yes, definitely. It's a concept that has been designed in South Africa using South African technology. It's only one of its kind in the world, and it's adaptable to any rural situation in any country, in any part of the world. So yes, it's an ideal mechanism for Africa.
Cost involved? Is it cost effective?
It's very cost effective. It's built at just around 90,000 rand, fully fitted, and it does 90% of primary health care, which an ordinary clinic could do.
So if you do get to go beyond the borders of South Africa, how would you see the partnerships working? Would you need input from other African governments as you go in, like you're doing now with South Africa?
Yes, I would only work with governments and the health departments, because we would need a guarantee that the service would be effective in the area where it is stationed. So definitely it will be partnership with governments only, because with government there's a continuous process through the Department of Health. Politicians change, but the civil servants remain the same, and we require civil servants to continue with the service.
The involvement, of course, of governments, like you say, and you say politicians change. The sustainability of that is if we see some of the governments coming in. When they come in, then they want to change everything and maybe good things. Wouldn't it be better maybe to get involved more with the people that will always remain, regardless of government?
People run out of resources, and it's more easier to access resources from government.
Big business?
Big business haven't played a role yet in this kind of concept. Yes, if you can get big business, it'll be a great asset in addition to government, but it cannot be done alone. It has to be government and this NGO, and if big business comes in, it's an additional sector.
Well, you say it's built in a factory, and what it does is to quickly provide medical, of course, on the doorstep. But major medical problems, can a facility like this hold?
No, it's not designed for major medical problems, but we have units which can be designed for major medical problems, like the hospital that we took to Bosnia in 1993, fully fitted with a theater, X-ray equipment. It can be done. But at this moment of time, the emphasis is on rural healthcare, the emphasis is on nursing staff, home-based care, cutting out doctors and medical personnel because of the scarcity of resources. So it is advisable to put up private healthcare units. But if needs be, we can go right up to first-class theater operations.
Well, Doctor, thank you very much for joining us, and here is hoping that the initiative does spread out across the continent, because there are people who do need a lot of medical care there. Thank you very much indeed, Dr. Suleiman, there with the gift of givers with instant, as it were, instant clinic.